Hi everyone, welcome back to my channel. In today's video, we'll see some important medical terminology practice questions for your CPC exam practice. Make sure you take notes while solving these questions. This is very important. Let's start with the first question. Before that, don't forget to hit the like button, share this video and also subscribe to my channel. Here's the first question. The combining form masto means. The options are bones, breast, muscle and ear. And the right answer is option B, breast. Next question. This abbreviation represents the brain and spinal cord. Option A, CNS, option B, PNS, option C, HTN, option D, BPH. And the correct answer will be option A, CNS, that is Central Nervous System. It includes the brain and spinal cord. Next question. The medical term for slow heart rate is option A, tachycardia, option B, pericarditis, option C, cardiomegaly and option D, bradycardia. So the correct answer will be bradycardia. That is for slow heart rate. The medical term for fast heart rate is tachycardia. Next question. What abbreviation will you use to describe the location of the liver in the abdomen? Option A, RLQ, option B, RUQ, option C, LUQ and option D, LLQ. The correct answer is option B, RUQ, which means right upper quadrant. RLQ means right lower quadrant, LUQ is left upper quadrant and LLQ is left lower quadrant. So liver is present in the right upper quadrant of the abdomen. So this is the image of the abdominal quadrants showing the organs present in the quadrants. It will be very helpful if you memorize it. Next question. Which prefix refers to the renal pelvis? Option A, flap, option B, salpinge, option C, pile and option D, pie. And the correct answer is option C, pile, which refers to renal pelvis. Next question. The presence of a stone in the gallbladder is called option A, cholecystitis, option B, choledocholithiasis, option C, cholesterolosis, option D, cholecystolithiasis. And the correct answer will be option D, cholecystolithiasis. Cholecystolithiasis is the medical term for gallbladder stones. Next question. Polyhydramnios refers to option A, increased bowel gas, option B, decreased bowel gas, option C, increased amniotic fluid, option D, decreased amniotic fluid. The correct answer will be option C, increased amniotic fluid. Next question. Alzheimer's disease is named for German neurologist Alois Alzheimer. What do you call the disease, structure, operation or procedure named for the person who discovered or described it first? The correct answer is eponym, option D. Next question. IUD is a birth control device that is inserted into a woman's uterus to prevent pregnancy. The I in the IUD stands for option A, inter, option B, infra, option C, increase, option D, intra. The correct answer is option D, intra. So IUD refers to intrauterine device. It is a small T-shaped device which is inserted into the uterus to prevent pregnancy. Next question. It is the main part of a medical word and contains the basic meaning. So here they are asking what is the main part of a medical word which contains the basic meaning. So the correct answer is root word. So that's it for today. Thanks for watching. Stay tuned for more updates and practice questions related to medical coding and CPC exam.